I'm Brandon Taylor. I was originally born in New England, but grew up in the Panhandle of Florida. Spent middle school and high school there. Later, got accepted to the early acceptance program for medical school in Mobile, Alabama. Did my undergraduate work there and then had a spot saved for med school and completed that for the next 4 years. I met my wife there. We couples matched into a residency program in the same facility and later did a fellowship in foot and ankle orthopedics in Memphis, Tennessee. For me, orthopedics made a lot of sense once I figured out what orthopedics was. I started med school and thought I was going to be an emergency room doctor or maybe even a cruise ship doctor, something with lots of intensity and maybe cool locations. Once I rotated through orthopedics in my third year, I was hooked. I saw that guys were, using drills, using hammers and screws and putting things back together, and that kind of resonated with me, as I like to work with my hands and like to see early effects and people changed. So that once I had rotated through orthopedics, I really didn't look back. The results with orthopedics, I don't have to wait 20 years and tell you to take a pill every day to get results. And if your leg is in two pieces, we put it back together that day or maybe the next day. And to me, that was more meaningful than trying to be a pill coach. One of the patient stories I've come to cherish is people that come in that really have no hope or think that this is the best they're going to be. And I've had a couple patients with bad ankle sprains or Achilles problems that were resigned to wearing different shoes and lots of padding and decreasing their activity level. I think that being able to change that with surgery, physical therapy, certain other treatments has really been beneficial for them and also rewarding for me as well. So our facility has 6 orthopedic surgeons, all under one roof with multiple specialties. We each do our fair share of general orthopedics, the normal things people would see, but we also have our partners that we can lean on for the more intrinsic and complicated problems. One of the nice things is we have MRI on site, we have physical therapy on site, we have small procedure rooms that we can do more minimal things like injections, RFAs, and we can get that done all here at one stop. I don't want to say like the first person you lie to is yourself, but I think about that a lot in the operating room. I always want people to have the highest level of care and I always want to make sure that it's done right and done perfect.